So this is a different type of eye problem. It's similar to the sagging eye, except it's called the heavy eye. So you can watch the video on the sagging eye, and in the sagging eye, that's everything is sagging, deep superior sulcus, inferior displacement of the lateral rectus, and medial displacement of the inferior rectus from the band, the superior rectus band. And so if you watch that video, you know that the normal configuration of the muscles is kind of like a cross, with the lateral rectus muscle and the medial rectus muscle being aligned in the yaw plane, and in the pitch plane, the superior rectus muscle and the inferior rectus muscle. And in the sagging eye syndrome, there's sagging of this superior rectus to lateral rectus band. In the heavy eye syndrome, the patients are myopic, and so they have a big eye. They might have a posterior staphyloma, so they got this big eye with this thing in the back. Here's the cornea. And so this posterior staphyloma can cause thinning in the back of the retina and retinal detachments and other kinds of problems. But the configuration created by that oval shape, that egg shape, moves and displaces the pulley. The same thing with the sagging eye, where the pulley has been displaced from sagging. In this case, it's a mechanical thing created by the big eye. And so the same quadrant is the problem, except the whole eyeball is going to be displaced up into that superior temporal quadrant. So instead of sagging of the superior rectus lateral rectus muscle band, the displacement of the big eye from myopia, axial myopia, will shift up into that slot. And so even though it's called the heavy eye, the eye is actually going up against gravity. So sagging eye is like a with gravity thing, and the heavy eye is kind of an against gravity thing, because it's just a big eye put in the same size socket. It produces a similar type of strabismus pattern, which is esotropia, and there might be an associated hypertropia. And normally it's easy to tell that they're a myopic eye because they have their glasses. But if they've had cataract extraction or they've had refractive procedure, you can't rely on the refractive area that's in the chart. So you might have to do an ultrasound to look at the axial length and look at it. But normally we can see in the back of the eye that it's a myopic configuration and a posterior staphyloma is present. So the heavy eye and the sagging eye are related conditions. They're non-neurogenic. They're not related to the muscle itself or the neuromuscular junction. So it's not the normal cause list, nerve, muscle, neuromuscular junction. It's just mechanical displacement of the pulley. And in the sagging eye, things are sagging, and in the heavy eye, the big eye pushes up into the superior temporal quadrant where the superior rectus lateral rectus band is, producing this moderate size esotropia often. And in severe cases, it can be very, very esotropic. And strabismus surgery again, but you got to be careful because the eye's thin.